Hello, my name is Bryce Farr, and my presentation is on nuclear chemistry and medicine, specifically related to conditions of the heart. During this presentation, I will briefly go over the findings of 5 academic articles. For the purpose of time, please feel free to pause on the images following each description of the article. Links will also be included underneath the images so that you are able to view these articles yourself if you so choose. The covered topics include PET and CT scans and the use of fluorodeoxyglucose for constrictive pericarditis, cardiac magnetic reconnaissance imaging and post-op congenital heart disease, single photon emission and coronary heart disease, technetium-99 and mortality in heart transplant recipients, and thallium-201 and myocardial perfusion. First, here is an example of a first-order integrated Rayleigh calculation. Please feel free to pause the video to get a better look. The first academic article that I researched was on PET and CT scans and the use of fluorodeoxyglucose for constrictive pericarditis. Constrictive pericarditis is a condition that limits the filling of ventricles due to inflammation of the pericardium. This condition requires surgery to be slowed. If detected early enough, the disease can be reversed. Scans that use fluorodeoxyglucose are highly sensitive to detecting inflammatory diseases. It is hypothesized that these scans can predict the reversibility of CP through steroid treatment. Please feel free to pause the video to get a better look at the methods. The results of this study indicate that PET and CT scans can predict the response to steroid therapy in patients with CP with high accuracy. Please feel free to pause the video on this image, and please feel free to visit the link below to get a better look at the full academic article. The next academic article that I reviewed was on cardiac magnetic reconnaissance imaging and post-op congenital heart disease. The goal of this study was to assess the uses of cardiac MRIs in evaluating post-operative congenital heart disease procedures and other related complications. Please feel free to pause in order to read the methods. The results of this academic article showed that 43% of patients suffered from post-operative complications, with 32% of these patients suffering from tetralogy of fallout. The most common post-operative complication in all procedures was pulmonary branch stenosis, followed by patch dilation and right ventricle failure. Based upon these findings, it was concluded that MRI is a useful imaging method for the evaluation of normal and abnormal findings after surgical repair for congenital heart disease and is effective in providing long-term surveillance. Please feel free to pause the video on this image, and please feel free to visit the link for a full view of the academic article. The third academic article that I reviewed was on single photon emission and coronary heart disease. Single photon emission computed tomography, or SPECT for short, is the most widely used test for the assessment of myocardial ischemia, but its diagnostic accuracy is not always reliable. The goal of the study was to test the accuracy of a cardiovascular magnetic reconnaissance protocol with an X-ray coronary angiography as a reference standard, and to compare CMR with SPECT in patients with suspected coronary heart disease. Please feel free to pause the video in order to read the methods and the significance. Please feel free to pause the video on this image for a better view. Please feel free to follow the link below for a better view of the full academic article. The fourth academic article I reviewed for this project was on technetium-99 and the mortality in heart transplant recipients. The aim of this study was to assess the prognostic values of stress myocardial perfusion imaging in heart transplant recipients. 2.5 years after heart transplantation, 166 patients were studied via performing symptom-limited bicycle exercise up to 40 grams per kilogram per minute, along with stress myocardial perfusion imaging. An intravenous dose of 370 of technetium-99 was injected at peak stress 24 hours after the stress test. Perfusion abnormalities were detected in 55 patients during follow-ups of 2.5 years. 54 deaths occurred, 16 of which were due to cardiac causes. The incidence of perfusion abnormalities was higher in patients with subsequent cardiac death than in patients without subsequent cardiac death. It is concluded that stress myocardial perfusion imaging with technetium-99 tetrosimin single photon emission computed tomography provides incremental data for the prediction of cardiac death in heart transplant recipients. Please feel free to pause the video as to view the data on these two tables, and please feel free to copy the link below for a full view of the academic article. The last academic article was on thallium-201 and myocardial perfusion. With the increasing use of multi-detector computed tomography, the number of detected cases with coronary to pulmonary artery fistula, or CPAF, has increased. No appropriate tests have been established to evaluate myocardial perfusion for patients with CPAF. The hemodynamic characteristics of CPAF were evaluated using thallium-201 single photon emission computed tomography. Please feel free to pause the video in order to read the methods and the results. Please feel free again to pause the video on this image, and please visit this link for a full view of the article. Here is a list of all my references. Thank you for viewing my presentation.